The things all over this place, but we're still in the mode of trying to sort things out. Big one behind the door there. Found some. First, there's the West Demerara Hospital. This is a pretty large regional hospital. We also have several smaller hospitals along the route, one at Fort Wellington and one at Maikoni. You know, the ratio of doctors to patient here is about just over 6 per 10,000 population. That puts an enormous strain on the few doctors that are here.
After meeting with a friend of mine, Prim, who's from Guyana, he told me about their medical needs and the opportunities and how excited he was to help us support the mission, and he and his brother really wanted to help facilitate it.
Paul and I have done other missions before, and I was walking to the operating room and Paul grabbed me in the hallway and he said, listen, I have this great opportunity, I have a great contact, and this may be a perfect place for our next mission. And right away, very excited about it. From there, it just took off. We landed in Georgetown, Guyana at 6 a.m. We basically hit the ground running. And the next thing we know, we have a televised news conference at 8 a.m. the same morning with the Minister of Health and all the key medical players of Georgetown and the region in general.
Okay, so I want to formally welcome you. They've come here not to perform clinical activities, not to perform teaching activities. They've come here to see what we have and how they can prepare for a future projection.
Knowing that the Minister of Health is fully invested in this, the level of support is there in the first 3 hours of us being on the ground.
It was exciting for us to have an opportunity to work with people that cared about the same end result that we did.
It's very clear realization this is something that's going to happen.
While a lot of this sounded promising, we were very uncertain as to what we were going to find.
Let's get in the car, let's go take a look around, and let's see where we can help.
Most of the population of Guyana lives at the coast, and the vast majority of the country is uninhabited. It's the very dense jungles of the Amazon.
We were both very excited about this scouting mission. Everything that we were hoping was there to make this trip feasible was not only there, but was apparent on the first walkthrough.
We wanted to be in and out of there in 48 hours, the least amount of time on the ground, so that if it was the right spot for us, then we could put all of our time into actual medical missions where we were treating patients and not just going over logistics.
We have some challenges with providing in-country care.
Well, there's a couple with training.
Well, there are a lot of regulars. They have there is a residency program.
Renal services, retinal surgery, orthopedics, and in obstetrics, for example, there's an acute shortage of such specialists, especially those complicated pregnancies. Right now, our in dire need of a urologist. Benign prostate hypertrophy, prostate cancer, patients who need chemotherapy, radiotherapy, actually have to seek them outside of Guyana. Kidney problems, stones, etc. that needs, we need help in.
For the most part, they have the facilities, they have the equipment. It's just sometimes the personnel is lacking, and that's kind of where we fit in.
The hospitals that we went to, and we went to a lot of them, had a wide variety of equipment. Some of the operating rooms were equipped with some of the most modern anesthesia and surgical equipment that were there, and some of them were empty. This was going to be the place where we were going to start.
You have to start off with smaller missions to provide more care, more education, with a partnership where we establish sustainability. We're not interested in just showing up at a healthcare clinic, providing a certain amount of care and then leaving. One of the key facets of our group is the educational component, where we will help train the doctors there so that even after we leave, there is an improvement or a certain aspect of care that is there that wasn't there before.
One of the advantages of being on a trip like this is the ability to be part of what we thought medicine was going to be like. Just people in need and our team that want to help them.
Really gets down to the heart of being a human being and helping those that you have the ability to help. Because at the end of the day, we're all in this world together.